Good evening, everyone. So this is the spotter. So you can notice that this patient is having subcongenital hemorrhage and raccoon's eye in the periorbital area. What are the differentials of this case? So, so the differentials that we can consider in a case of raccoon's eye with subcongenital hemorrhage. The first one is traumatic. The second one is vascular, the most common one being subarachnoid hemorrhage. Then obviously infections like whooping cough. Immune mediated causes can be there. Amyloidosis is another cause of raccoon's eye, malignancy, hemophilia and other blood disorders, and certain iatrogenic causes are also there. So this is the story of an 16-year-old boy who presented with pain and redness of both eyes with raccoon's eye for the past 5-day duration. So this patient presented to the ophthalmology department. So he was giving history of pain, redness and watering which started in the left eye and then later progressed to the right eye on the next day, and he got admitted to the ophthalmology department. These are the other images. So you can see the subconjunctival hemorrhage and you can also see the raccoon's eye here. Now the various investigations done, the routines were normal. The counts, the bleeding and clotting parameters were normal, and the CT brain showed no fractures or orbital pathology. Now, as everything was normal, patient was shifted to the internal medicine department and he revisited the history, which revealed cough of 2 weeks, which was dry and severe, and the patient revealed a history of fever, which lasted for 4 days, 10 days back. Now, this was the cough that we have recorded. So, in this video, you're able to listen to the woof. So, you can see the patient is having a severe cough, and after 3 breaths, he takes a deep inspiration, and the woof can be heard. The diagnosis of whooping cough is made by the classical woof that has been recorded. The patient was treated with azithromycin This was a sample that was sent to the state public health laboratory, which revealed an IgG levels of more than 200 and a value more than 100 was positive. So this revealed a positive case of complications of whooping cough. So they can be related to infection like pneumonia and otitis media. They can be mechanical like subconjunctival hemorrhage, abdominal wall hernia, urinary incontinence, lumbar strain. All these are due to the severity of the cough. And rarely, intracranial hemorrhage, stroke, and encephalopathy are also possible. So this patient was vaccinated. So can it still be whooping cough? So we searched literature and we found that the efficacy or the IgG levels in whooping cough serially reduced, and by 8 years after the vaccine it approaches zero. So it is possible that a patient who is fully vaccinated can still be having whooping cough. So right now I am summarizing the case. So this patient presented to the ophthalmic department. There was no history which he gave initially regarding the cough or fever. It was thought to be a viral illness and with some cough. So this case reveals the importance to revisit the old fevers that were prevalent in the earlier times. As number of patients are not vaccinated and as the efficacy of vaccine wanes over time, it is possible that whooping cough may re-emerge. With that, I am concluding the session. Thank you.